My name is Kira Reddy, and I am a senior at Red Cloud High School. My first question is, have you seen health improve within minority groups during the COVID-19, and especially indigenous groups?
Thank you. Actually, it's the opposite. There was a recent analysis reported that among African Americans and Latino Hispanic populations, we may have lost as much as 2 to 3 years of life expectancy in the first 6 months of the pandemic. And this may sound like not that much, but it's actually huge for a population to see a gap of 2 to 3 years. And so this actually reflects the disproportionate burden that has impacted. We have less information on Native populations just because they're dispersed and national estimates are harder to generate. But if we've seen that with African Americans and Latinos, I could almost certainly guarantee that a negative adverse effect has been experienced by Native populations as well. The only advantage is in the tribal nations, isolation may have helped some. We know that Navajo Nation had a very challenging time early on in the pandemic, in the early part of last summer, but that may not have been experienced by all nations. So I think that that's one advantage. I know that one area in South Dakota, I believe, basically self-isolated, wasn't letting any outside people come in except for essential services and products. Let me say that we have made progress in healthcare of minorities and addressing disparities. For example, life expectancy for African Americans is steadily improved over the last 20 years. And among people at 65 and over, prior to COVID, there was no difference between blacks and whites. And that has a finding, that's something that's been present for about 12 years. And that is an advance that had not been seen for a long time. Latino Hispanics are the paradox that they actually, as a population, live longer than whites. So it could be that there are advantages that are not fully understood despite their socioeconomic disadvantage that they have. And if we were able to generate data for Asian Americans, we would probably see a similar. The national estimates are not available, again, because the size of the population, the National Center for Health Statistics has been hesitant to publish these until they're absolutely certain that they're accurate. So COVID has not led to any improvement of anything that I'm aware of, at least not, there's big concerns across all groups about more substance use. Overdoses are again going up in some groups. Obviously, risk about alcohol use, risk about mental health, depression, stress. You can imagine if you're saying, well, I isolate at home, but your partner is an abuser, and you're exposing yourself at a greater risk of being abused. And it wasn't as easy to move out of those situations. So all of these concerns have been recognized. We don't have a full handle on the extent of the problems that have been generated by COVID, but these are some of the concerns that we are now just beginning to see and be able to evaluate and try to redress with interventions as much as possible.